Arthroplasty is joint replacement, so I work with our joint replacement surgeons and see a lot of joint complaints in clinic. Generally just trying to get people when they first get that diagnosis and what can they do to manage their pain, and a lot of people aren't ready for surgery right away, so I work with them on what their options are. I always really enjoyed science all through school and learning about how things work, specifically the body and how things function. And I had a couple family members that worked in medicine in different roles, nurse, surgeon, and knew I kind of wanted to get into that field. I can, physically interact with somebody, feel, how their body's moving, figure out what's not working correctly, and really kind of follow them through the whole process, being able to participate with my hands and really have that impact and directly getting them feeling better. And then I get to see them in their post-op visits and see how they progress and how things are improving. I really enjoy working with the whole team here. Being able to learn and work with all of them throughout my day has just really been very valuable. Something special about working with the U of M here is all of these physicians have a priority in teaching. It's being able to hear a different perspective and see how a different surgeon likes to operate, and being able to be a part of their teaching experience has really been something important. I have a really good mix, which is something that was important to me, being able to care for people in different facilities. One of the best things for me is being able to see those patients in their post-op visits, being able to talk with them and they say, the pain's gone. I'm back to doing the things that I want to be doing. If things go well, then they get to move on and enjoy the rest of their lives. Being able to have a role in restoring that, it's incredible.